Hi.
Hi, Amy.
Oh, do I look suitably alive?
Um, Welcome. No, you're absolutely fine.
Oh,
How are you?
I'm okay. I'm okay. I've got my tens machine on, whacked up to the max, so I should be good.
Oh, bless you. We are ready to go live.
So before we go live, can I just clarify one thing with you? My
Yes.
cam, if I'm looking at my camera now, but it's on the side of my iPad. So does that look correct to you?
Let's see. Yeah, that looks fine.
Okay, fine. Because obviously human nature is that we just look at whoever's talking.
So where are you looking now?
So now I'm looking at the camera.
I can see you. Yeah,
Yeah.
that's
Okay.
better. Yeah.
Okay. Okay.
And we are going live. So let's hope technology works. Yes. And we are live. So, hello everyone. Hello, amazing, lovely community, ladies of wealth and wellness. Surprise live joining today, and I've got an amazing guest. So, I'm really thrilled to share with you something very special today. We have Amy here who is joining us from Elemental Health. Hi, Amy.
Mhm.
And this wasn't planned, it was quite spontaneous, wasn't it?
It was.
And I want to share the story behind this. What happened yesterday? My daughter came from school and said, Mom, my youngest daughter is 6.5, nearly 7. She says, Mom, tomorrow, there's a special day tomorrow at school. And I said, what special day? Tell me more about it. Well, check the email, but we need to wear something yellow. I'm like, okay, what's happening? And I checked the email and it said is the mental health awareness day. And I thought, wow, okay, well, yeah, we better make sure we've got something yellow to wear. But then I thought, wait a minute, that's a special occasion when, we've got to share this, something about, mental health awareness, everyone talking about this important topic. And the first person I thought about that, it was Amy. And then the second thing I thought was like, wait a minute, Amy had an accident recently. She hurt her back. It's like, how do I get to have a chance to speak to her on this important topic? How do I get her to be our guest here and share her mission and her vision? Because I've heard some of her mission and vision on the previous interview we did with 3 other ladies from this community, the biggest fans that have been supporting the growth of this group. So I thought, let me see if she will be up for such a spontaneous introduction to the group. And she said yes. So it's amazing having you here. I'm really excited to be talking about mental health because, to be honest, it's something that I never really was that invested in. My background is general nursing. I've always kind of been more focused on physical health rather than mental health. But my own journey of experiencing burnout and tapping into holistic health and learning more about mental health and how important it is for us to look after not just our physical health, but the mental health as well, has taken me on this journey to connect with more women like Amy who have story to tell. And they're really building something amazing. It's not just a story, but they have a mission and a vision. So here we are, Amy, to this point where I'm going to pass it on to you to introduce yourself. You've been quite active in the community, so many people probably already know you, but just tell us a little bit about you. What's been your journey of mental health, because that's your professional background, but becoming a business owner and what you do now, but a little bit of the backstory of how it all started.
Mm-hmm. Well, thanks so much for thinking of me initially. And my name is Amy Abid, and I am the director and founder of Elemental Health. My background is similar, so it's in adult nursing, not mental health nursing.
Oh.
And I felt quite ignorant, really, to some of the diagnosis of mental health. You know, as far as I was concerned, in a neurosurgical trauma environment, you're going to be anxious if you're in that kind of place. That's about the limit of my involvement with mental health as a nurse.
Right.
Yeah. However, so I moved from the UK, from Sheffield, where I was a nurse in one of the busy neurosurgical trauma centres. I'm also ex-army, so I used to be a combat medical technician back in the day. And we moved to the Isle of Man. And literally one day, completely out of the blue, seemingly, I woke up and I had no idea who I was. Like, I have never had any issues with my mental health ever. I did have a very traumatic pregnancy the year before, where I had planned my baby's funeral, been told to plan the funeral. And then 4 weeks after that, my dad very suddenly passed away. So now I look back and see it as a perfect storm, really. And I genuinely think that I had to go through that to get me to this point now. So at that point, on that day where I didn't recognize myself anymore, I needed to tell my husband. My husband happens to be a psychiatrist. So I was nervous, to say the least, to explain to him that I don't know what's wrong with me. And he took me to work, and I was seen by one of his colleagues who put me on a lot of medication, which I absolutely needed in the short term.
Mm-hmm.
And that was my life for the next 2 years, surviving the day, waking up thinking, please, God, don't let that feeling crush me in my tummy again. But yes, it's still there. And how quickly can I go to bed tonight? I had a baby. I had no support network. I was in a new country. It was winter. And I was just drugged up most of the time.
Wow. And how long ago was this, Amy?
So this was a decade ago now.
Yeah.
And I went through that, and I went on to different medications and medications to help the side effects of the other medications. Yeah. And literally probably about maybe a year in, I was doing psychotherapy as well, which I found challenging. And I asked my husband, is this what you get if you're a mental health patient? Is this what you get? And he said, yes. And I said, well, that can't be right, surely. With all of our background, my husband was a neurosurgeon. I did an academic PhD in neurosurgery before becoming a psychiatrist. So I was like, this can't be okay. There has got to be another way. And if there isn't one, then I'm going to invent one with you. And he was like, okay. So I spent the
talking about from a breakdown to a breakthrough and creating something. Yeah. Well, it reminds me of something that I posted in our group recently, a few days ago. It was about, I think it was on Monday. What's your biggest pain or obstacle that you've overcome, and what's the vision? Mm-hmm. And you commented that your biggest breakthrough or obstacle that you've overcome is yourself, your own kind of journey of starting your business. It wasn't just starting the business, but how you got there.
Mm-hmm.
And I read that in a post because it kind of shook me to my core thinking, this is what it's about. For someone being able to be vulnerable and say, okay, this is what I've gone through, but also to say, this is, I'm going to find way. I've paid the price, for this. I've suffered, but I don't want this to happen to other people. If I could help other people, find ways for managing, better situations like this and conditions like this. And you've pulled yourself from that place to start inventing and designing and bringing something to life, which started as from your own pain, from your own struggles, right?
Yep. Yep.
And yeah, so just tell us a bit more about that. How, from all this horrific experience, how did you then started, your business Elemental Health?
So, I started spending around 6 months between being dosed up on diazepam. I started looking at the research and I was looking for something which had to be grounded in neuroscience and evidence to work, but I wanted something that that was non-invasive, non-pharmaceutical, and that felt like quite high-end, like self-care. And I came up with flotation. So when we first started, we were called TheraFloat, and
Okay, I'm just making little notes. What did you find first? Flotation, did you say?
Flotation, yes. So
Okay.
we researched flotation. We went and tried the flotation. The pods that you get in, shut the lid. I didn't like it. I just did not enjoy it at all. So I thought, maybe off the back of something like that, maybe something else has been developed with the same or similar properties. And then I found dry flotation, which is a
Oh,
contradiction in terms, right?
yeah.
But it was perfect because for the people who maybe had mobility issues that couldn't get in and out of wet environments and be showered, people who were claustrophobic, anything like that, this was perfect because you didn't even have to get undressed. So you lie on a bed, and
Mm.
it's on a hydraulic platform, and the platform sinks. And the idea is that the everything is warm to body temperature. So your brain then, within about 10 minutes, gets the mental bandwidth to switch off. So it actually has been shown to put your brain into the theta or the flow state,
Oh,
which is
wow.
the state you get into when you meditate. And
Meditate. Oh, yeah.
most people can't do that. So the technology we have in clinic does that for you. So that's how we actually started out. Then COVID happened. And then all sorts of other sort of smaller issues happened. And we thought, okay, maybe we need to offer better value. Maybe we need to think more broadly about what we're trying to do here, which is support people's mental and physical health, but on a cellular level.
Right.
So now we're getting into the realms of mitochondrial medicine. So the mitochondria that powers every single cell in the body.
Yeah.
We wanted to go after that. So we came up with a biostacking technique, which involves, number one, cryotherapy, which is cold therapy.
Cold therapy. Yeah, I've heard of that.
Yeah. So it's not a chamber. You don't have to get in it. This is on a hose pipe. So it almost feels a bit like you're getting a spray tan. It's local. And it's local, again, because people with mobility issues can't get in and out of chambers. It would be too much for the nervous system. So this allows us to spot treat areas of severe inflammation. So we use cryotherapy. We use something called PBM, which is a medical grade of light. It stands for photobiomodulation.
Mm-hmm.
It's actually a non-invasive form of stem cell therapy. It's phenomenal. It will heal and treat most things. So it won't cure things, but it will alleviate anything that's inflammatory in your body.
Wow.
And then finally, we end the session with the flotation. And then when a client comes out of the room, we use a helmet on their head, which is, again, the PBM helmet. but it's at a much higher wavelength to penetrate the cranium. So
Right.
that is how we became elemental health, because we use some psychotherapy. So I trained to do some psychotherapy. We use cold, we use light, and we use water. Hence the name change.
Wow. So it's, yeah, the different elements of that.
Yeah,
I love
yeah.
that. I didn't
And that,
understand what that was. Because I see you wear this thing. Is that the helmet?
yes. So the thing, so the thing is actually one of our pathways, because obviously we live on a little island which not a lot of people can get to. So our service that we're promoting, or we're trying to teach people about,
Yeah.
is the at-home mood reset. So we
Oh,
call it
yes,
we
that
call it
home kit.
yeah, clinic style results, living room comfort. Do it anywhere you like, and that's the headset that you're talking about. Yeah, yeah.
Yes. Yeah, I love seeing that. And I did read a few posts on that, but I didn't understand the everything else that you did as those elements you've just described. So tell
Yeah.
us about the two different things then. With the home kit, what do you get? What is that? This is a
Oh,
great opportunity to share with them.
okay, so the at-home mood reset does what it says on the tin. It resets your mood at home. So you receive a box through the post, and in
Mhm,
that box, you receive the headset.
mhm.
You receive 3 months supply of the world's most researched nootropic supplements. Now that could be any number within a range, whatever we discuss is best for that patient. So for a
Mhm.
lot of people, they take something to help with their focus, their concentration. Other people, it might be more energy or sleep related, just depends. But you get three
Mhm.
months supply of that.
Mhm.
And the box is sent to you. We schedule a Zoom call. It's a 2 hour appointment initially. And in that 2 hour appointment, we really dive down, get to know each other, get a brew. And, people turn up in the pajamas. It's come as you are, come as you
Like you say, lounge your home,
yeah,
like
with
lounge comfort.
babies, breastfeeding, whatever, anything goes. It really doesn't matter at all to me. And we dive into a lot of questionnaires. Now, some of these questionnaires are quite tricky. They talk about things like, are you feeling suicidal? They talk about your libido. They talk about every single aspect of how anxiety and depression could or may affect your life.
Okay.
That's why it takes so long. And we schedule breaks in, and we have
Yeah.
a bit of downtime. The purpose of this is that there's a very solid baseline, and
Mhm.
we have a score at the end. But also at the end, we have somebody sat in front of us with a headset on, who is confident with what they're doing. It's all been set up. They understand how they use it,
How
and
to use it, yeah.
their first session has been delivered. And I do a session with them as well, with mine on, so they can mirror me.
Right. My question to that is, how long is usually this treatment or this the use of this device? How long do you recommend that for?
Yeah. So the pathway itself is 12 weeks.
12 weeks pathway. Okay.
Yeah. The research recommends you, if you've had one incidence of depression, you should use it for up to 12 months.
I see. Up to
Mhm.
12. Okay. So this is what people can get delivered at home, and obviously with the consultation, the support. So back to the elemental, the more deep dive to what you do. How
Mhm.
do you deliver that? Is that, do you have a clinic? Do you have a place for that?
Yeah. So we have a beautiful clinic. There's a very short video on our website of the clinic. It's in the grounds of essentially a castle. It's very beautiful. Feels very spa-like.
Wow.
There's no waiting room. The idea is that you never cross with another client, and because of where I live, everybody knows each other as well. So we don't want people knowing, oh, they've been here or whatever. So it's very, very small. It's very much, we go into details like, before someone books an appointment, are there any smells which you find exceptionally triggering?
Mm,
So if someone's lost a grandparent, and that grandparent wears rose perfume, I would make sure that any of the scents that we use, essential oils, etc., that are just there to fragrance the clinic, that they're not used, because we don't want to trigger memories. There's an
yeah.
awful lot of thought goes into every appointment, and we also offer silent appointments, completely silent.
Wow, I've heard of that. I've
Mm.
heard of those type of retreats and appointments. It is very interesting. Wow, thank you for sharing this. And I'm curious. So the two different types of support. So the in clinic in person ones, who are they most suitable for, and the one for home treatment, who are they for?
Okay, so the in clinic is only available on the Isle of Man, and that is
Mm-hmm.
for anybody with typically the kind of people that I see have got long COVID, they're burnt out, they need a rest, they've got chronic pain. Um, Often they might have got a skin problem as well, and there's often more than one thing going on. So if
Yeah.
someone's anxious, then they've often got an element of depression, and
Mm-hmm.
often they'll have a lot of aches and pains because that's quite characteristic of anxiety and depression.
Yeah.
So it because of the way that the treatments are stacked, you get a lot of bang for your buck because we're treating everything all at once,
Holistically, right? You're not
holistically in the clinic,
isolating.
with the cold, with the heat. The cold therapy, we also use it on the vagus nerve to
Oh
help to
yeah.
reduce relaxation. On the other side of that, the at home pathway is available anywhere in the UK at all. This is for people who are anxious and depressed. You don't need a definitive diagnosis from a GP. You
Mm-hmm.
don't need a GP referral. It is used off label if we deem it clinically appropriate for things like ADHD and PTSD. That is upon our clinical investigations, if you like. But for the vast majority of people, anxiety and depression, and within usually around 4 weeks, we see a huge reduction in people's symptoms. If I'd not used this myself, then I would not believe this. Now, this actual piece of technology, I found it by accident a couple of years ago because I myself was trying to wean off something called sertraline, an antidepressant. And every time I dropped even the smallest dose, I became really, really symptomatic. And I'd kind of just been thought, right, well, that's it. I can't get off it. There are
Yeah.
no guidelines. If you go to your GP, you'll get different advice. So
Mm-hmm.
I tried this and thought, wow, it can help me. Oh my God, I can't believe it. And actually, I weaned myself off with very tolerable side effects. Yes, there's still withdrawals, and they are typically very, very, very difficult to deal with. So, a lot of what we do with the at home reset pathway is we support people with medical titration of antidepressant therapies, or we help them to not have to increase their dose. Or
Right.
some people come with a prescription in one hand and a big question mark of, can you help me? Can I try this before I commit to pharmaceuticals?
Yeah.
The interesting thing is, if you're already on an SSRI, particularly, the studies show that using the device actually increases their effectiveness by about 35%.
If you are on, what did you say?
Pardon?
You said if you are already on SSR,
If
was
you're already on an antidepressant, if you already
oh
take an antidepressant,
yeah,
then by using this device, it increases the effectiveness of that antidepressant
yeah.
by around 35%.
Wow. Yeah, thank you. I lost that word. I didn't hear. This is so important to kind of show people that there is solutions, and often these solutions are hidden in someone else's pain, causing them to look for those solutions, right?
Mm-hmm.
Because the quick known solutions out there is to reach out to a prescription, and so many conditions do need prescription and do need the traditional medical treatment. No question, no doubt about that. I still keep my registration as a nurse. My husband is in psychiatry as well. So
Mm-hmm.
I understand that our jobs as professionals, can treat people, but my own journey experiencing severe burnout and experiencing a lot of chronic stress and things like this have led me to also seek solutions, holistic solutions, and hearing about what you have discovered and what you do. It gives me that hope that we have collectively, especially in this group, we have so much truly wealth of wellness that we can bring and we can share with each other so that we can help someone else maybe who's navigating a challenging time. We could not only connect, there's so many opportunities to collaborate or use all the experiences we have to share, to recommend, to refer each other, to build this momentum of growth, and to share the message. Each and every one of us have a message and a mission and a vision to share. So
absolutely. I just wanted to, before I forget, the 12-week pathway that I referred to earlier, every single week during those 12 weeks, I check in with the individual. So some people literally just want to voice note me. And some people want to email, some people want a Zoom call. So I am guided by what they are reporting to me, and we can preempt things. So if we know there's going to be an anniversary, something difficult coming up for somebody, we can put structures in place. So a lot of this journey is also about education. And because you're a nurse and you can't ever really take that nursing hat off, you look at people very holistically, don't you? And start to offer out other. So for example, somebody who's on the pathway at the moment with chronic back pain, who also takes a statin for cholesterol.
Yeah.
And they've tried everything. And I was saying to them, how much water do you drink? Do you realize that you need a lot of water to make your discs nice and plump and fat? And do you take coenzyme Q10, because we know simvastatin can deplete that in the body?
Yeah.
And he was like, no. And anyway, put all these things in place, pain gone. And he's like, but that's just the nursing side. So that's the other side that I'm not just looking at someone's mental health. Yeah, I'm looking at everything.
You're not looking at one point.
At the end of the pathway, I speak to people again for another hour. We schedule in an hour, and we basically do this is where you started, this is where you've ended up. And most people can't even remember how bad they felt at the start. And when we go back through that data, it's quite emotional for a lot of people.
Yeah, I
bet. We can represent that data in a nice book, in a nice PDF, as a keepsake. And then we have memberships that people can sign up to, so they still get their supplements delivered, and so they still get the accountability, and they get the chance for us to change the stimulation, because I can do all that digitally.
Okay.
If that makes sense. So it's connected to an app. It's connected to an app. So if somebody says to me, Amy, it's the first anniversary of losing my mom, I'm going to really struggle, I can reset that schedule to allow them to stimulate more often during that week.
Oh, wow. So you've got that flexibility.
Yeah.
Amazing. Amy, this has been a great talk, great discussion in really hearing your journey and understanding more about the business side of your services and how and what you do. And I know your mission is that you get to spread the word about this, and you get to reach to more people, especially here in UK. And again, today, this was one of the reasons for me to say, hey, let's get you here in the group. Let's get talking about this, because I believe in your vision, in your mission, and I wanted to contribute to spreading the word. And again, this is what I really build this community for and continue to invest, because I want this to be a safe space and a platform to raise voices and speak up on important topics, to have this opportunity to bring visibility to meaningful missions and visions like yours, and to really use this opportunity to invite other women, because I know there's so many amazing professionals and experts in this group, women who are on a mission to do something very special in their field. So I want to invite you to, if you've not introduced yourself in the group, please do that. But if you really want to take this platform and use all this momentum we've been building the energy in the group, the engagement. I honestly spend 20 plus hours every week putting effort to keep this community engaged. And this is not just a Facebook group. This is truly a network, a platform for growth. So I'd love more people like Amy to step forward, to raise visibility of their business and services, not just to be a member of this group, but to take opportunity to come to the networking events we're doing, the online networking, to join speaking panels. We will be launching next week. Next Friday, we have another doctor joining here to speak on menopause, the behind the scenes of menopause, what's not been spoken, not just quick tips and insights, but diving deeper, like Amy is diving deeper on mental health today. So basically, this is my invitation to women who really want to grow with this platform. There's ways to be part of, use this as promotion of your business once a week, to be part of panel discussion or this type of interviews. And this is introduced in a structured way. We'll be introducing these 3 tiers of membership where you get to benefit for a very small investment of starting at £17 a month. You become a member of the online network, or if you want to be a speaker, the next level is £37 a month, and the top level is where you actually get to be part of the group as a group leader and be able to show daily with comments, with engagement, with posts. So this is something that I want to do for the members. I've invested months and months of building this community, so more women who want to spread awareness of their mission and vision show up to deliver value, to showcase what they've got, but also to contribute to the growth and help women who are members of this group by sharing their expertise and sharing their knowledge. And I hope whoever's watching this is going to be live in the group. It's going to stay for the whole of the rest of the month. I hope people are getting how passionate Amy is about what she does. And I hope if anyone else wants to do the same, to showcase their business, their mission, just drop me a message and I can share more about how you can not just be a member in the group, but how you can just stand out and use this group as a platform for growth, for visibilities, for spreading that message wider for what you do and why you do that. We're looking here for meaningful connections. This is not just one of those groups where you post and nobody likes your post, nobody comments on your post, nobody cares, faceless groups. This is really different, and I'm really passionate about spotlighting individuals like this who want to make a difference with their businesses. So Amy, thank you so much. I know yourself, just to be even here today, you're a brave woman. You hurt your back and to show up again, it shows how passionate you are about what you do and how giving you why you want to share this with more people. So thank you for showing up, and I hope your painkillers are working for your back.
But thank you, and thank you so much for putting the time and effort into this group, because like you just said, it feels special, it feels different. As a member of many other Facebook groups, it feels like this is a movement. There is a change coming, and I love it, and I'm so thrilled to be part of it. So thank you so much for not only the opportunity today, but for putting all the time and effort in, because it really shows. Thank you.
Oh, lovely. I'm going to send you with lots of love and thanks again. And hopefully you get time to rest this weekend. And yeah, let's stay connected in the group, and there will be more of these talks coming forward to give value and to spotlight other businesses. Thank you.
Great. Thank you. Bye-bye.
Bye.